Hi, everyone. Today I have with me Melissa Biscardi, registered nurse, manual osteopath, and concussion clinician with me today. Hello, Melissa. Thanks for being here.
Oh, hi. Thank you so much for having me as a guest.
Yeah, so first, let's get started with you telling us a little bit about yourself and then the work that you do.
Sure. I do practice in downtown Toronto, and I primarily see concussion patients now, but it's certainly been a windy road for how I ended up here. I started as a registered nurse and working in reproductive medicine. So I worked at two different fertility clinics. So that would be doing IVF and in vitro, or sorry, artificial insemination, cycle monitoring, all that kind of stuff. And then I worked in nursing research for a bit. And then I was really missing like that one-on-one with patients. And I met an osteopath, and he kind of inspired me to go down the road of osteopathy. And then, sorry, this is long-winded, but
We want to hear all about you.
that's my life. And so I percolated for a while, but then I decided, okay, yes, I kind of want to switch into osteopathy. And while I was in school, probably a little, maybe halfway done, I started to have memory loss. And the memory loss started small, and it kept getting worse and worse to the point where I would not recognize my patients or not be able to, I knew them, but I didn't know their name. And I would just forget what happened at school, like no recollection, even looking at my notes, and then forgetting people I knew personally, like their names. Someone I had known for 10 years, I couldn't remember her name. So it was really, really scary, and no one would take me seriously. So I had this, that invisible injury, got lost in the healthcare system. No one had any answers. And like my colleagues would just laugh at me. But of course, early 30s, I was terrified. Like that is way too early for Alzheimer's, cognitive decline. And I ended up having to dig myself and find my own answers as to why it was happening. And it ended up being related to an over-the-counter supplement I was taking, which is like another story. But what that really led me to be passionate about is the brain, for sure. And also helping people who are lost in the system really get proper care, and how would you say it? Having a clinician who is invested. You're not just in and out in 2 minutes. So yeah, so that's how I ended up just focusing on the brain, concussion, and optimizing brain health.
Okay, what a journey,
Yeah.
Yeah, you've done a lot of this, and our personal experiences are so important in shaping what kind of clinician we become or what kind of person, professional we become. I definitely feel that because that was my story too. Coming to this pathway and being more focused on period health is because of my own problems. Yeah. So let's start with the basics. What
Okay,
happens in a concussion? What is a
sure.
concussion?
Yes. So a concussion is a mild traumatic brain injury, quote unquote. And it really will happen when the brain, which is like a jelly or jello, is shaken in the skull. So you actually don't need to have an impact to the head. It can happen when there is just a shaking. So for example, in a fall where you don't hit your head, or in a motor vehicle accident, that causes that sort of acceleration and deceleration of the brain inside the skull. And a concussion is a functional injury, though. So while the physiology will be altered a little bit, there's no mass inside or bleed if you do an MRI. So if you get a concussion and you have an MRI, it should be clear. Nothing should show up. And then there are really two stages to the concussion. So there's that initial part where you either hit your head or you get shaken, and you might feel dazed or see stars. You might lose consciousness, but you might not. That's not a prerequisite. And you might have amnesia about the event itself, but then shortly after, you're okay. You're like, oh, that was nothing. And I sort of draw a parallel with, let's say, a sprained ankle. So if you're running, you roll over something, you think, oh my gosh, I think I hurt my ankle. And then you shake it out, and then you think you're okay, so you finish your run. Same kind of thing happens in a concussion. There's that initial phase, and then you might shake it off and think, oh, I'm okay. I'm going to finish this game. But the next day or later on that day is when you start to feel it. It's when that inflammation starts and the headaches or light sensitivity begins. And then you know something has happened.
Right. So you touched on a couple of the symptoms that people can get from a concussion. So what can symptoms look like, and how, to what degree can they be variable in different people?
Well, it really can vary. It's kind of like that snowflake analogy. Now, if you have pre-existing health conditions and anything really, anxiety, depression, migraines, polycystic ovarian syndrome, anything to do with your thyroid, you will have more symptoms and a longer recovery. And I call a concussion the great magnifier, because whatever your body is used to going through, just times it by a million. So if you usually get migraines, you'll get more migraines. Now, if you're someone who doesn't have any health conditions, and you get a concussion, especially your first one, headaches are the most common, for sure. Some people experience dizziness. It really depends what has happened in the head or the fall. So you can have dizziness, blurred vision, light sensitivity, noise sensitivity, sensitivity to smell. And then anytime there's a concussion, there is also a component of whiplash. And the reason is the threshold for whiplash is actually lower than for a concussion. So you have to get the whiplash to get the concussion. And so you usually have neck pain to go along with that, and stiffness.
Okay.
And yeah, and then, sorry, just to keep going
yeah,
on
please
that,
keep going.
so those are more symptoms, but then there are some changes that will happen. And women definitely get the short end of the stick on this, like we do on a lot of things. And it's well established that women will experience, or a good portion of women will experience, changes to the menstrual cycle. And this was actually what my master's research was on reproductive changes post-concussion. And there is a great variation with that too, depending on how bad the injury was and your pre-concussion state. But women will lose their periods from 1 month to years after. And maybe you'll have amenorrhea, so loss of your period for 3 months, or just skip one period. You could get an extra period. There's just sort of a cornucopia of changes that can happen around there, or just more painful periods, just something is different. And it's believed that this is due to hormone changes that happen because that pituitary gland in the brain is sort of shaken up, and some of that communication between the ovaries disrupted.
Mm-hmm.
So it's really interesting.
Yeah, and for people listening, the pituitary gland controls a lot of the hormones that affect our estrogen and progesterone production and testosterone production. A lot of those hormones are impacted from the hormones that come from the pituitary. So it's a multi-step process. So that makes sense, right? Like, because the brain is impacted, the downstream effects are felt in all over the body, because there's so much crosstalk. I talk about this with all my patients. We talk about this with, when we're learning as well. That's why it's so hard to piece things together sometimes, because everything is connected and intermingled, and you really need to follow the thread to figure out what's coming from where, and then go upstream to figure things out. So we talked a little bit about the symptoms. We talked a little bit about how women are more prone. Can we explore that a little bit more? So like if a woman does have a concussion, what are some of the long-term effects that we can, and that goes from women and men, I guess, but we know that in women, those even just risk of like dementia and neurocognitive changes later in life can definitely be worse than in men. Can we speak to a little bit of the neurocognitive changes over time and future risks? Because a lot of my patients, I know they're like, yeah, I had a concussion a long time ago, and then and then we figure out that some of the mood changes came from that concussion as well. So yeah, so can we talk a little bit about all of that?
Sure. So, and it really does depend on the person and their risk factors, but your population would be a high risk, right? Because they do have other things going on. Now, there's a lot we don't know about concussion and over the long term, but what I found in my thesis, which was really interesting because we did, my participants were between 1 and I would say 6 years. So it wasn't long term. But what was really interesting is the cognitive scores, which some of them were very low in terms of percentile, like under 10th percentile, so the bottom 10% of the population, that's super significant. And also the other symptoms persisting, those headaches, a lot of mood stuff really persists. And yes, the thing about post-concussion syndrome, because after about 3 months, that's what it's labeled. It's like that initial concussion part is resolved. Then you're into this constellation of symptoms and body functioning that we're still learning about. But that can last in many, many years. And I honestly, it really depends who your healthcare team is also, and what you did in that first little bit. It's really critical what you do right after injury. So definitely changes in cognition can persist. And then it's complicated by, and then did you go into menopause? Were you premenopausal? So it's, there's just so much to it. But definitely that and the mood changes are huge that persist, and headaches that is something else that really persists over time.
So tell us a little bit about the acute phase and then what some of the strategies look like in addressing a concussion versus some of the long-term strategies if like a concussion was not addressed, or if it was addressed and we still need to continue with care.
Sure. So it used to be that we thought you should just shut yourself in a dark room when you got a concussion, right? That was the strategy for many, many years. And then maybe 6 years ago, the thinking around that started to change. So one problem is some practitioners are stuck in that old model. And I mean practitioners across the board, not one designation. And it's just not the best advice. What we know now is after you've sustained a concussion, in that first 24, 48 hours, you should be taking it easy, limiting your screen time, definitely not playing your sport, but you should be up and about. You should be walking, should be eating. You don't need to have someone wake you up every hour. Yes, you're not like a fragile piece of crystal, right? So we know that a small amount of stimulation is good. And then really after that 48 hours, you should be starting your rehab. You should be starting aerobic exercise. This is really, really, really well researched. And the reason is because it supports your autonomic nervous system. And what happens when you get a concussion or any trauma really is it shakes up your nervous system. So the aerobic exercise symptom threshold though, so you're not doing so much that it's making you feel worse, really supports getting that nervous system regulation, the blood flow going. So that is what you should be doing in the beginning stages. Now, for example, if people come into my practice, I have a certain framework. So there's that aerobic exercise part, but then there's also a diet component. Some people eat well. Some people's diet would actually work against the recovery. So we want to make sure what they're putting in their body is going to be low inflammatory and nutritious. I do recommend some supplements depending on the person. And oh yes, and then things to address the whiplash. So those sort of components in the initial stages will really support your recovery. Usually visual therapy won't start for, let's say, another week or so, because it can sort of aggravate people.
Okay. So in summary, like at the beginning, we want to make sure, like, we've got to get rid of this idea that, if someone falls asleep, you're waking them up every hour.
Exactly.
Because we also
If
need
anything, let them
sleep.
sleep.
Yeah.
Yeah.
Our brain needs to
Right?
sleep to heal, for sure. Yeah, and then eating nutritious foods, maybe making some changes to the diet so that we're having a low inflammatory load, maybe addressing some of the inflammation if necessary through supplementation and other supplements to increase, a healthy neurotransmitter balance and hormonal balance.
Exactly.
Like that. Yeah, that sounds great. And then what happens in longer treatments, or if so let's take a concussion that, just recently happened. How long can a treatment take to have this person return to normal activities? I know it's variable, but for example, what does that look like?
So I will say mechanism of injury will definitely makes a difference, and how many concussions you've had. So let's say it's your first concussion. Well, some people won't even make it to my office because they have a really quick, seamless recovery. But let's say you're not that person and you end up in my office, then so usually what happens is people will see me once a week for 6 weeks, and then we start to space it out. So at about 6 weeks, you're feeling pretty good, right? You're back to work, you're back to normal. But what will happen is it's still a little bit of up and down. So when you push yourself too much, you'll have that energy deficit, and you'll almost feel reconcussed. Like some of your symptoms will come back. So it is a little bit of an ebb and flow. Now, by 12 weeks, you should be good to go. But I want to say that first bit is about 6 weeks long for like your usual concussion that ends up in my office. Now, there are people who end up in my office 3 years later, right? They've really been suffering. And those ones, usually it takes longer, and the approach is very, very similar, right? I say, okay, how is that autonomic nervous system doing? Because that's the first thing we need to address. And then sort of weave our way through the other things. Motor vehicle accidents definitely take a lot longer. I feel like just the amount of force that happens. Yeah.
Okay.
I can give you an idea.
Yeah, and my next question was going to be around those people who had concussions in the past, and their symptoms were, maybe okay at the time, but they feel like things shifted and they're more prone to like headaches, for example, or more prone to stimulus affecting them. Sounds like there is still hope for them to address some of those things, absolutely. But the strategies you use are similar. Does it take longer for those people then because we kind of left it at the beginning?
I'm going to say usually it does, but let's say probably you have to give it about 3 weeks, which actually isn't that long when someone ends up in my office after 2 or 3 years of suffering. But I tell people too, so let's say you're a 10 out of 10 in pain and we bring you to a 9 out of 10 on visit 1, you're not going to notice a difference. And, an 8, but then when we get you to about a 7, you're seeing the light. So yeah, there's definitely hope for people who've been suffering for a long time. Often they haven't had someone who used an effective approach, really. That's, or an effective approach for them, right? Yeah. Because there's always that sort of relationship.
Okay. And then we touched on it a little bit, but what are some of the long-term consequences of having a concussion, especially if left untreated?
Mm-hmm. So one concussion, really, you should be fine. But it's really with the multiple concussions where you start to see more long-term changes and effects. And also, I mean, we see this in football players, like really around sports. And so those long-term changes can be changes in mood, persistent changes in mood, like irritability, anger. You can just have a loss in your ability to function, like your ability to do a number of tasks, and like go to the store and then go to the bank and then go grocery shopping. Like you would just become overwhelmed. And certainly the changes in reproductive function can persist over time. And so what's interesting is for women, the mean age of concussion is 31. So that is like right smack dab when a lot of women are wanting to have babies. So I think, this is really interesting with respect to that. Yeah, and again, like cognitive changes, memory loss, those can really persist over time, long term. But if you get into a practitioner, you can minimize that. So even memory loss, because there are therapies that can help, just neuroplasticity, right? The brain is plastic and can improve. So I always tell people that no matter where you are, we meet you where you're at, but you can get better. Maybe you're not going to end up with that 20-year-old brain you had, but where you can get better and, and improve your quality of life, improve really your relationships then, because you're doing better.
And I know we talked a little bit about like women and their hormones. Can we talk a little bit about concussions in children? Because a lot of my patient population has kids. So how does having a concussion earlier in life impact growth and impact hormones moving forward? And are children a little bit more able to bounce back easily? Oh, yeah.
Yes, absolutely. Especially just from one concussion. Like most of us had concussions as kids, right? Children are very resilient. And sports, so there's a movement that not to let kids play in sports, but actually I think that is not the right idea. Like sports build resiliency. So, and I really think that early play time, like 2, 3, 4, less time on the iPad, more time out there building resiliency is a really good idea. And kids can bounce back from concussions, absolutely. And because the brain is so plastic at that time. Definitely, I don't treat that many kids. Usually I request that or I only will take them if they're a child of one of my existing patients or by referral. But what I see is, and it's the same with adults, but when you follow the treatment regimen, they just fly through it, right? So, which is amazing. I think parents should be a little more, don't be wild about it, but know that your child is not so fragile and can be resilient and can recover if they fall and hit their head. They can play sports safely.
Yeah. Yes, it sounds like you have a structure in place that you can work for adults and children, and it's similar. Like it's still addressing the same components, because for healing we all need similar things. We all need adequate sleep. We need plenty of water. We need anti-inflammatory foods.
Absolutely.
Yeah, and a good amount of activity and good circulation as well.
Yes, absolutely. And for children, the assessment would be a little bit different because depending on, how old they are, they will not have developed certain, even in the eye movements, they won't be as precise as in an adult just because their brain hasn't developed. So I sort of have to modify what I'm looking for, but definitely they can heal very well.
Yeah. Okay, and then I know you had mentioned that your memory had changed a long time ago. Not a long time ago, but like when you were in your early 30s. How did you bounce back from that? What kind of strategies did you implement in your life to help yourself?
Yeah, so it was actually a little bit of a process. And so once I figured out that it was this over-the-counter supplement that I was taking for my sleep initially, because I had terrible sleep for many years, I cut that out, but healing still had to happen, right? And that did not help the fact that I couldn't sleep. And not being able to sleep is not good for memory. So it's, again, this whole like web where everything is connected. So then I had to work on my sleep, and I changed my diet. Like, a lot had to happen, actually. So I changed my diet, which was primarily carb based. Like, I really was just inflaming the heck out of my body. So I switched to more like fat-based, protein-based, and that slowly, very slowly, I want to say it took at least 6 months, helped with my sleep. And I say that because, I did have my blood glucose tested, and it was, wasn't diabetic, but it wasn't ideal, right? So
Yeah.
I realized, oh, my blood sugar is going up and down all the time. So I worked to stabilize that with my diet, and then slowly I was sleeping better, and I wasn't on that medication, which was interfering with my neurotransmitters. And slowly my memory came back. But now every time I have a memory lapse, I still actually get really anxious about it because, I was traumatized really from that whole experience of just so while the brain is resilient, it's also fragile. I guess that's really um, what I
It's
realized.
true. And blood sugar dysregulation, going back to that piece, is
Mm.
at the crux of so many different conditions. It's at the crux of PCOS, for example, right? Insulin resistance is what drives the inflammation forward,
Yes.
cardiovascular disease, so many cognitive issues, so many mood issues are built upon insulin
Oh, yeah.
resistance and blood sugar dysregulation. And it runs rampant in our society, I feel. And because we're also
Oh, yeah.
testing only, HbA1c, which is a marker of your 3-month glucose levels, and your actual glucose levels, we're not really ever comparing it to insulin that your body's releasing. A lot of that goes undetected, but it's a big factor in sleep quality and all of these things that we just talked about, for sure.
Okay.
And then we're
So
recording
what?
this. Sorry, go ahead.
I
There's a
was going to
lag.
ask
Yeah,
if
there's a slight lag.
can I ask you a question?
Yes, please do.
Okay. What do you test in terms of like blood? What would a panel look like if you were looking into someone's blood glucose, insulin, etc.?
Yeah, so if someone's coming in with suspected PCOS, or if they do have PCOS, I like calculating HOMA-IR, which is an insulin resistance factor, and that takes into account fasting blood sugar, so fasting blood glucose and fasting blood insulin at the same time. So in the same blood work, we want to run those, and there's a calculation that you can do, and it'll give you a score. So the higher your insulin resistance factor is, and then we want to address that. If it's healthy and good, then that's great. But not oftentimes, pretty much all the time with my PCOS patients, it's off. Pardon?
Oh, I got a little lag in there, but then I got you back.
Okay, got it. Yeah, same. A lot of people are using up this bandwidth.
I know.
Yeah, so like I'll do those two tests, and oftentimes, like when we look at the blood sugar and the fasting insulin like separately, they look fine, they're within normal range,
Right.
but when you compare them and do that calculation, it's off. So that's typically what I use in my practice to determine that. And then now back to you. So we're recording this during COVID-19. So what are some of the strategies that you're implementing in your life right now? I'm asking this question to all my guests. What are some of the strategies that you're implementing in your life to take care of your mental health, to take care of your brain, to take care of your body in this time?
For sure. So one thing that I am trying to do is read like a novel. So I just started a new one last night, and it's really funny because it was a gift from a patient. It's called When Breath Becomes Air. Have you read this book?
No, I haven't. What is it about?
So it is about a neurosurgeon. So I guess it would be his memoir. He wrote it right before he passed away. It's a neurosurgeon who got lung cancer, like terminal lung cancer. And I'm honestly like one chapter in, but it was sitting on my shelf for over a year, maybe even 2 years. And last night I picked it up, read the first chapter, and one of the questions he's asking himself is, like, what is a life worth living kind of thing? And wow, that was just, it hit me at the right time, because what I'm starting to think is, right, like, what is it about my life that I'm missing right now, or that I want, that existential crisis that we're all going through right now, but I'm finding it comforting at the same time. Like, what is it about life that I love? So appreciating and gratitude is helping me through. I've been coloring a little bit as therapy, which I have found very helpful. Reading, coloring therapy, those are the main ones that I've been using. For my patients, I've been giving a couple of, like, my nervous system strategies. Oh yeah, I've been humming. So that's one that I really love to, like, support our calm, and the parasympathetic nervous system is just like humming in my throat to calm myself down. That's really
Can you tell us a little bit more about the humming?
Sure. So yes, absolutely. And so our vagus nerve, which is the calming part of the nervous system, travels right down our neck. And so that's a great way for us to access it and stimulate it. And it's amazing how powerful simple strategies are. Like, you can even put a heart rate monitor on your finger while you do it, and you'll see your heart rate go down. So I just tell people, well, you could certainly hum a song, or just hum. You can play around with it, but when you really get in your throat, you'll feel it, like, tickle your lips even. Yes. So, and just do that for a few minutes. But also, the power is in the repetition. So try and do it like a few times a day. I really like that one.
Yeah, and that's so easy and easily accessible to
anywhere.
Exactly.
Yeah. Exactly. It's free.
Kids can do it. Adults can do it. Yeah.
Exactly. So I do really like that one as well. Okay. And trying to limit the news is probably the other thing. At first, I watched way too much, and now I'm just watching snippets. Because I'm an empath, right? And you might be too. I feel like healthcare providers in general. So just getting everyone else's energy. So I'm trying to create space for myself.
Yeah, that's good. And that's one of the strategies that I've been hearing from so many people, that we're limiting the news because it's too much, right? It causes so much anxiety, so much stress, and then it keeps us up here versus, like, down in here where we need to be more right now. Mm-hmm. So absolutely. Melissa, thanks for being here. Where can people find you? How can they connect with you? Where do you hang out? Tell us
Sure.
How people can access you.
So on Instagram, I'm at the.rehab.lab. But also, I would love if everyone who watches this would go to my website, rehablab.ca, because a pop-up will show up and there's a free download, and it's called Concuss Now What? And it's basically a guide. You can print it, put it in your first aid kit. It's what to do in that first 24, 48 hours. It's what to look out for, red flags, what to do, what not to do. So it's a one-pager that I think everyone would benefit from. And just reach out one of those ways.
That's an awesome resource. I'll link your Instagram and your website in the description for this video, so everyone can have access to that, because I am definitely going to go and print that out and put it in my first aid kit. I feel like we all should have that. And when we're in panic mode, everything is out of our brain, right? Like, it does not function properly. So having access to resources like that is important. Yes. Thank you so much for being here, Melissa.
Thanks for having me.
For sharing all your wisdom. You are full of wisdom, and I know there's more there, so I'm going to pick your brain another time.
Sure. We'll have a part 2.
Yes, for sure.